Hello, everybody. Welcome to another CCHI community conversation. My name is Jorge Ungo, and I am the CCHI Language Access Advocate. We're so excited to see all of you joining us. We've got the room slowly filling up as people are coming into the room. So we'll just give it just another minute or so, and then we're going to turn it over to our conversationalists. We've got a wonderful conversation that's already gotten started behind the scenes today. We've got four dynamic individuals, very passionate individuals about today's topic. And we're going to kick it off here with our chair of CCHI, Vanessa Costa. Vanessa, it's all yours.
Thank you, Jorge. It's really exciting to be here today having this conversation among friends and colleagues. I'm Vanessa Costa, CCHI Chair. More relevant to this conversation, I'm an interpreter, a nationally certified healthcare interpreter for Portuguese. I am 23 years into a healthcare language access career, and I started young. This was my first chosen profession, so it'll be about 23 years before anyone lets me retire. So I'm very much invested in what's happening in healthcare language access today and what kind of future we're creating for those of us who still have a few decades left and for the next generation of interpreters. So I'd like to turn it over to Prado. Prado, you're joining us from Tampa.
Hi, good afternoon, and thank you for the invitation. It's wonderful to be here. I'm Prado Antolino. I'm the manager of language services at Moffitt Cancer Center. We are a cancer center in Tampa, Florida. I am very much like Vanessa, about 24 years into this language access trajectory. I am a translator and an interpreter by training and by passion, certified in both disciplines. And I work with an incredible group of interpreters and translators within my own day-to-day job. And I'm very happy to be here and share this time with you all. And I'm going to pass it off to Bill.
Hello, everyone. Thank you so very much for this wonderful opportunity to talk to so many friends and colleagues and professionals that are dedicated a lot of their energy and time and life force into this beautiful world of language access and interpreting. I started as a Spanish interpreter back around when dinosaurs roamed the earth. Actually, my company is Language World. We started in 2000, and that's been my work for 25 years. And so we're a full service interpreting service provider, language access specialist, translations, etc. And about 5 years into my business cycle, I started a second company called Fluency, which manages interpreting operations via a software as a service platform. So those are the two things I do, and I'm super thrilled to be here. And I'm going to toss it over to John Arrojave.
Well done. Thank you, Bill. So excited to be here. Thank you, Vanessa, for the invitation. It's wonderful to meet Prado. It's wonderful to be with everyone here. So my name is John Arrojave, director with Cross-Cultural Communications. I also run a regional language service company. But CCC is the main reason I'm here. CCC has been focused on training interpreters. Since 2001, we started training interpreters for Johns Hopkins. We have always been in the area of interpreter training, language access, cultural competency, and it's the first thing I encountered when I came into officially, professionally. I've been around interpreting my whole life, but it's the first thing I encountered when I got to the interpreting world. How do we train interpreters? How do we transition to being more and more of a professional service so that we can earn more as professionals and we can show our value and earn the respect that's deserved. I'm always struck, right? An interpreter, I'm just thinking of Prado, or someone at Tampa General, or any of the many staff interpreters I've worked with. It's in any day, they'll see 60, 70 different disciplines, how many different providers, how many different scenarios. And it's just the wealth of experience. It's almost awe-inspiring what interpreters do. So yeah, just excited to be here to talk about this.
So we're really happy that the three of you have agreed to have this conversation. You're here because you were among the first folks to endorse our new pledge, the Equity Starts Locally pledge. And just to give a little background for folks who haven't learned about the pledge yet, we launched it this summer, CCHI, marking the 15th anniversary of the National Valid, Credible, and Vendor-Neutral Certification for Healthcare Interpreters here in the U.S. And this pledge is meant to turn our attention to the state of healthcare interpreting today, to the future of the profession, and to our collective focus on building up cultures of language justice within our local communities. And so, what this pledge urges stakeholder organizations to do is to commit to developing and implementing strategies to strengthen language access infrastructure wherever they're providing service, wherever they have their brick and mortar, and to invest in building community capacity for language justice. And this is something that each of you are already doing in your own way. But I want to ask you first, Bill, why did you endorse the pledge?
Wow. Well, thank you, Vanessa. I'm so grateful to have the opportunity to talk about what I've been doing for so long. So I started my interpreting agency back, and when we started, there was no California Healthcare Interpreting Association. There's no standards of practice. There was no national certification. It was catch as catch can, and sort of like Craigslist. Whatever you see, you grab and you take and you go. So the fact that CCHI is here and has helped us develop the profession is so instrumental. And my driving focus since I started was to make interpreting a career. There's no use having infrastructure and learning and certification unless there's a job at the end of this tunnel. And my focus has been to create a true salaried profession with benefits, medical, dental, vision, vacation time, a 401k, just like everyone else has in the world that works, 40 hours a week. Of course, that's not easy to do with so many different languages, but if we could be creative and assertive in the fact that national human beings that reside in the United States and hopefully near our medical systems that understand the cultures and communities that are in these hospital systems and clinics. These are the people we need to reach, and these are the people we need to employ and provide a living wage, which has been very, very challenging because, as you know, lots of things have become remote and people are talking about AI, and there's lots of things that are happening that seem to work at cross purposes, to all of the massive amount of work it took to develop language justice via professionally certified, trained, prepared interpreters. My job, and I will take it to the end of my career, is to assert the fact that this is a career. This is not a side gig. This is not something that you do just because it's what you got. I'm trying to change that, and I really need the medical systems to help us on that pathway. Thank you.
That's a really good point. I grew up as an interpreter in a public health system up in Cambridge, Massachusetts, Cambridge Health Alliance, that has a really robust in-house language access program. And we used to say we're from the community and therefore we are for the community. We are passionately local, and no one understands the health system as well as we do. We're patients as well as employees. No one understands the challenges of the community as well as we do. We live here. And so we were able to do so much more than just language conversion. We were able to start to extend that culture of language justice beyond the walls of the hospital into the community and bring the community in as well into the design of the program. And that's something I know that you're trying to do, Prado, in your area.
Yeah, thank you. When I looked at the pledge and I looked at the 3 kind of requirements to be part of the pledge, I was almost jumping in my office. Oh my God, we meet all 3 requirements. But in all seriousness, the reason why I signed the pledge, one, because it felt like it was a no-brainer. We have one of the very few centralized language services departments with in-person interpreters working here, and translators as well, by the way. And in the current climate that has been going on for a while, where departments are actually closing, it feels even more poignant that I signed that pledge. Institutionally, I feel we have all of the right infrastructure in place. I work with a magnificent group of interpreters who are incredibly well qualified, nationally certified, committed. They know the community, they know our patients. And we feel very supported by the providers who are actually our internal customers, and we're considered as part of the team. And looking back at the career trajectories of really all of us, it seems like around the 2000s, when I started at Moffitt in 2003, there was a lot of stuff we have now going on that we did not have. And when I look back to then and I look to now, I'm very proud to say that language services at Moffitt has become intrinsically part of the fabric of the organization. And I personally, in my sphere of influence, I try to work with small business owners that sort of share that same passion and sense of service. And I know one of them is probably listening today. And I feel a responsibility to hire these companies, to contract out with these companies that at the same time are taking care of their interpreters.
Yeah.
And I reject the big service language providers. Nobody please be offended by these who are trying to make business at the expense of the livelihood of interpreters. So I take my hat off to Bill, who's doing that as a business owner. And that's really the reason why, because this is the sole purpose of my career. I love this profession. And like Bill, I want to retire from it, having made a livelihood out of it and potentially helping others do the same. And in that process, helping our patients.
Mm-hmm.
Can I just say one quick thing about a medical system that has in-person interpreters? It's good business, isn't it, Prado? Isn't it like, doesn't the community say, oh my God, look what we have?
Yeah.
You know, we've heard patients tell us, the interpreters in the team can, I think, attest to that. I mean, I've heard this message from the patients themselves. I'm still a practicing interpreter myself. You know, sometimes we go to other health systems within Tampa Bay, and our family members have to become the interpreters, or sometimes we have no interpreters at all. So when we come to Moffitt and we see these friendly faces, the patients get used to our interpreters get used to our patients. I mean, there is a lot of intangibles that are not measured in numbers, and they're not measured by dollar signs. And I know I'm preaching to the choir here, but so true, so true.
Mm.
No, absolutely. I mean, the in-house interpreter does so much. The local interpreter does so much. They're able to close the gap between what should be happening on the front lines and what's actually happening. They're able to advocate as employees or community members or patients or family members of patients for better systems and for more provider training. And really, in most healthcare organizations, it's the interpreters that model the best practices for the providers and kind of fill in the gaps of what those clinicians did not receive in medical school or in nursing school in terms of training on how to effectively communicate, with the different populations and through interpreters.
You know, along those lines, Vanessa, when you think about, I just hear you going through and cataloging and hear Bill talking about it, hear Prado talking about it, and you just start to think of, let's say, a return on investment, thinking of it purely from let's say, a CFO perspective. I mean, have they really, looked at studies, or have those studies been conducted that really start to catalog all the areas where costs accumulate when you kind of decimate your local language access infrastructure? I just feel like a lot of the CFOs or a lot of the leadership, not to obviously do it as diplomatically as possible, haven't really explored everything that's impacted from a quality, not just a quality perspective, but also from a financial perspective. When they're thinking about the patient journey, when they're thinking about medication adherence, when they're thinking about readmissions, when they're thinking about all the tests that are ordered that probably don't, are they really looking at, hey, we used to invest X in this population, and now, look at X, look at what we're doing. That kind of makes you think, is it going to come around? So I try to be an optimist in all these things, and I have heard of shifts to where they get rid of the interpreting department, then they bring it back because providers frequently will say, bring me an in-person.
Yeah, I feel, and I would love to hear Vanessa's perspective on this, as when in your times of being director of multicultural affairs. I have heard personally, but language services are not generating revenue departments, and it takes a lot of effort, not a lot of effort, but I mean, it's sort of my job to educate on why it's so important to have an in-person interpreter department, you know, and sometimes I'm more convincing than others, but I always jokingly like to say, but do you know how much money we're saving the hospital just in liability, right? Because we've never had a lawsuit come to us, so we're saving you money, but that's a very almost rough, raw way to really explain what we are doing for the hospital. And to your point, John, I'd love to see
studies.
Yes,
Studies.
help
What are
us,
all the
help us.
questions? Let's map out all the questions. Let's do studies. Let's demonstrate the
And
values.
yeah, to me, it's really about health equity. We all talk about it. We all say that we are trying to attain it or achieve it. No one has yet, but we'll get there faster when we have systems of linguistic justice built into our communities. Because without language justice, there can be no social justice. Without language access, we will never get to that goal of health equity that we're working towards. And so, really, language access needs a seat at every table, at every improvement project within the hospital. It needs to be part of the health equity work. And it's very hard to accomplish that if you don't have a language access program in-house. And it's not so much about modalities as it is having your language justice advocates present and having them participate as members of your institution, as members of the care team. They will advocate for better practices that will benefit everyone, including your partners and vendors, including the interpreters who are working remotely.
Absolutely.
Absolutely.
And they manifest themselves in patient experience. And not to say that remote should go away entirely. There's definitely situations and use cases, but what is true is that a lot of times it's been completely oversold. And then even their interpreters are transient and come in and out of the profession. Ultimately, what we want is obviously, if we're focusing on patient outcomes and not just dollars and cents, we want a profession where a qualified interpreter can have a viable middle-class life. And an offshore, let's say, remote interpreter also has an opportunity. But when the focus is strictly dollars and cents, I think we get away from what's the end goal, patient experience, quality, all of that, all the things Bill talks about as well in terms of creating a profession for everyone.
I think, oh, go ahead, Vanessa.
No, go ahead, Bill.
Well, I was talking a little bit earlier with the crew, and if you hear a blower out here in my garden, that's what's happening. I may have to switch around, but I'm here. You know, the interpreters, there are many people that come to the job as interpreters, and some of them don't know they're linguists. Some of them come from other professions. Some of them are college graduates with no idea what they want to do, and because they're bilingual, this seems to be like a great place to start. And we have exiting people, older people that have ended their careers and want to give back to the community. And we're hearing a lot about AI, and we're hearing a lot about things that are going to change and displace people. There may be a role for interpreting to be that job that's win-win-win, which is win for the providers, a human being still on the phone, win for the patients, obviously somebody from the community that understands the cultural ramifications of illness within the context of community, and also something to keep people paid and busy domestically, so that we're all not scrolling through Instagram and doing something productive and making a couple of dollars. There's nothing wrong with making a couple of dollars, being a remote interpreter or somewhere else. So I just, you know, we're so many medical systems and the people that are budgeting for these systems feel that it's a bargain to get rid of these human resources. And we are going to pay a price for not fielding and nurturing human being linguists in all of our communities. It's going to be of critical national importance. And I don't know how, but I just know it.
Yeah.
Every time I hear about a hospital that's, you know, shuttered its language access program, and there have been 2 in the past 6 months here in Florida, and that's just Florida, it's happening all over the country, it pains me. It's like a stab to the heart, because I think about what's happening in the community. You know, when you've removed your language justice advocates, your champions, you know, who is there to point out what's broken and what needs to be fixed, to point out the concerning practices that need to be changed? I spoke to a national nationally certified interpreter who works remotely, and she said, she's limited in her scope. If she says something unpopular, all the clinician has to do is hang up, and then she's gone, and she can't impact that patient experience anymore. But your staff interpreters can. They can challenge, they can encourage, they can exhort, they can do so much to transform the experience within an organization. And they can do what the civil rights activist Shirley Chisholm said. She said once, if they don't save you a place at the table, bring a folding chair.
Yeah.
And that's what hospital-based interpreters and their leaders, people like Prado, have been doing for decades. And we can't stop now. Our work is not done.
And you made a really, really good point, because in educating others, providers, and even patients on how to work with interpreters in an effective way, I mean, at the most basic level, that's what we do one-on-one. And I have always been talking to the team of interpreters. They carry a responsibility to advocate and to educate one-on-one. And if it takes 10,000 interactions to educate, then it's going to take 10,000 interactions, because when the systems grow so much, and even Moffitt is growing right now, how many in-services can you do? How many pieces of information can you throw on the internal communication channels? How many things can I post on our intranet page?
Yep.
It still takes the one-on-one conversation. And I always tell the team, when you're educating, then ask the provider to go tell a friend. And this go tell a friend, which sounds so silly, every once in a while it actually does work as well. So to your point, Vanessa, that's 100% correct. And I think it's perhaps another point that gets lost in the entire conversation when we're talking about going all remote, no blending of anything, only one thing or only the other.
Mm-hmm.
And along those lines, I do want to ask Vanessa, right? We have a ton of interpreters joining us, right? And we've heard what remarkable people like Prado, yourself, Bill have to say about this. What if you're an individual interpreter, you're certified, how can you move the needle on this big issue?
That's such a good question. As an individual, it's a really good question. I would say that you maybe can't move it as an individual by yourself, that it's going to be a concerted effort, that, consider finding the other individual interpreters that live in your community. If you don't work in your community, start to ask why. In the institutions where you receive care, start to ask about their language access program. I took my son to a hospital in St. Pete, which is still kind of Tampa Bay area. And when I identified myself as a healthcare interpreter, because they asked parents, what's your profession? The nurse looked at me and she said, oh, honey, I wish we had those. And so I began to ask, as the mother of a patient, well, what do you do when there's a mom or a dad who requires language assistance? So I think if we start asking those questions in our communities and finding the other interpreters and asking together, joining local interpreter associations, and of course, achieving the highest credentials we can, then together we can move the needle. But we can't do it alone as individuals. It's too big.
I think we would be remiss if we didn't identify what's happening in Springfield, Ohio, about the demonization and otherness of the Haitian human beings that live in that town, that are trying to make a decent living, that are actually have been invited to that town to rejuvenate what was depopulating and ending. And so, all of us, whether we're interpreters or not, we have to be very cognizant about what a lot of people in this country think about people from other countries. So I don't know what that does about voting or organizing or donating, but it's absolutely, it's not getting better. That's what's really messed up. It's just not getting better after all these years.
I also think that, as LSPs or as language access program administrators, we do have to stop thinking of ourselves as victims of the movements of the industry. I hear this a lot. Well, that's just the industry. That's how our industry moves. That's what, the demands are. That's the projection. I think we have to take a stand at some point, like Prado did, and said, regardless of how the industry is moving, this is how we're going to do language access in my organization, in my institution. This is the culture we're going to build. We are going to shape what happens locally. And when we begin to think that way, and we think that way together with others in our neighborhoods, we can shift or maybe shelter our local language access infrastructures from those movements of the industry, which really are a race to the bottom.
Yeah.
And it seems, in discussion after discussion, anecdotal evidence after just all the evidence that accumulates, it's almost undeniable, right? The value of local interpreters, but it's always the issues, how do we translate sort of those intangibles so that we can make the case at a C level, right? And I'd love to see more studies. I'd love to see more advocacy as well. I'd love to see more organizing. Yeah, I'd love to hear your thoughts on that, Prado.
In a way, sometimes I feel I live a little bit in a bubble, because of how the institution has surrounded the infrastructure for language services, right? When I've talked to other interpreters that have come to interview for jobs in a hospital, and they're contract interpreters, and they talk about their perspectives and the lack of support when they're doing their jobs, there's some information that I've observed that has broken my heart, because I feel like, wow, our interpreters don't go through that. I have to tell you that whatever we've been able to do at Moffett is not enough. And I actually would love to see more organizing too, so that we can make a difference, not only for programs like mine that are gonna need to be preserved, hopefully they're not gonna disappear, but to inspire other hospitals and other healthcare systems to emulate us, hopefully, and do even much better. There's so much room for improvement. And then to also protect those interpreters who are working individually with no supporting systems at all. Some of the in agency interpreters out there, I feel like I'm speaking for them and I should not. I'm just, drawing from the experience that have been shared with me. They go and they do this job, and much like the remote interpreter told you, Vanessa, I don't have a role because they're gonna hang up on me. For the agency interpreters, it could be, oh, you're not, oh no, we don't accept what you're saying. Do your job, just interpret, stick to your role. So now how do we go about that? The question makes me feel a little bit guilty, because sometimes I feel like I should be doing much more by doing different things, and then life happens and I don't. Right. But I think that there should be much more organizing, and alone, individually, we cannot do it either, to Vanessa's point earlier.
Well, we're hoping that this pledge is a start. And just to recap, we're asking stakeholder organizations, and this can be hospitals, clinics, language service companies, interpreter associations, language justice stakeholder groups, immigrant groups. We're asking that you take the pledge and commit to doing at least one of three things. And the three things are supporting hospitals and maintaining in-house language access programs, employing qualified healthcare interpreters who live in the service area. The second thing that you might pledge to do is prioritizing recruitment of nationally certified healthcare interpreters for employment and contract work, and invest in local partnerships to identify and develop interpreter talent in the communities we serve. So we're hoping that folks will talk to their leaders within their health systems, they'll talk to their supervisors within language companies, they'll talk to each other within interpreter associations and say, let's take this pledge. Let's pledge to begin work on at least one of these areas, wherever we are. Let's take some action, brainstorm what are some strategies that we can put on paper that will help us uphold these objectives. And then finally, let's tell others about the great work we're doing. And so we're hoping that this is the year that we start a movement, because equity starts locally.
Let's do it.
Absolutely.
Love it.
That's
Thank
great.
you all so much for being here today, and to Prado, Vanessa, John, and Bill. Not only do I want to thank you for being part of this community conversation, but for carrying the torch for this profession, and being out there doing all the right things to keep this profession flourishing and growing, and to ensure that our patients are getting the quality language services that they deserve. So thank you all. Thank you to all of our guests for joining us. We are recording this, so the recording will be on YouTube soon. And have a wonderful rest of your day. And again, thank you all for joining.
Thank you
Thank
Bye.
you.
Bye,
So
everyone.
much.
Thank you very
Bye-bye.
much.
very much. Bye-bye.